Hello, my name is Jacob Shindu, and thank you for taking the time to watch my video. Today I will be describing and demonstrating how to access flexibility for the straight leg raise, Canadian trunk forward flexion, the YMCA sit and reach test, and the chair sit and reach. Before performing any of the flexibility assessments, you want to make sure your client warms up for at least 5 minutes of moderate intensity. The Canadian trunk forward flexion test assesses hamstring flexibility. For this test, you will need a flexometer, sit and reach box at the 26 centimeter mark. The client will sit without shoes, and the sides of the feet will be flat against the flexometer. The inner edges of the soles are placed within 2 centimeters of the measuring scale. Make sure that your client has their hands parallel or with fingertips overlapped. They should not be leading with one hand. Your client will reach forward with both hands as far as they can while exhaling and dropping their head between the arms. While reaching, ensure your client holds for 2 seconds. The legs should be extended but not pressed down. The client is allowed 2 trials, and the score recorded is the most distant point recorded in centimeters or inches. After recording the test, the best test score of the 2 trials, refer to the norms table for the Canadian test. The Thomas test assesses the flexibility of the hip flexors. These muscles tilt the pelvis anteriorly. An imbalance between these muscles and the hip extensors can negatively affect the functioning of the lower back. Once again, before performing the Thomas test or any of the flexibility assessments, you want to make sure your client warms up for at least 5 minutes for moderate intensity. For the Thomas test, have the client or participant lie supine or on the back. The participant brings one leg, the contralateral leg, or the leg that is not being tested, in the direction of the chest, just to the point where the lumbar spine is, snug to the floor or table. If the tested leg remains in contact with the floor or table during this maneuver, the hip flexors of that leg are adequately flexible. If the tested leg rises, its hip flexors are likely to be inflexible. Short. References Howley and Franks, 2007. And record whether the hip flexors in the right and left legs are flexible or inflexible. Before performing the YMCA test, clients or patients should perform a short warm-up prior to this test and include some stretches. It is also recommended that the participants refrain from fast, jerky movements which may increase the possibility of an injury. The participant's shoes should be removed. For the YMCA sit and reach test, a yardstick is placed on the floor and tape is placed across it at an angle to the 15-inch mark. The client or patient sits with the yardstick between the legs, with legs extended at right angles to the tape line on the floor. Heels of the feet should touch the edge of the tape line and to be about 10 to 12 inches apart. Note the 0 point at the foot or box interface and use the appropriate norms. 2. The client or patient should slowly reach forward with both hands as far as possible, holding the position approximately 2 seconds. Be sure that the participant keeps the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion or yardstick and sit and reach box. The score is the most distant point, centimeters or inches, reached with the fingertips. The best of 2 trials should be recorded to assist with the best attempt. The client or patient should exhale and drop the head between the arms when reaching. The tester should ensure that the knees of the participant stay extended. However, the participant's knees should not be pressed down. The client or patient should breathe normally during the test and should not hold his breath at any time. The chair sit and reach test is a measure of the ability to perform ADL, such as climbing stairs and getting in and out of a car, chair, or bathtub. Equipment needed is you'll need a folding chair that has a seat height of 17 inches 42 centimeters and that will not tip forward, as well as an 18-inch 46 centimeter or half yardstick ruler. Test procedures. Place the folding chair against the wall for stability and have your client sit on the front edge of the seat. The client extends the leg being tested in front of the hip, with the heel of the floor and the ankle dorsiflexed approximately 90 degrees. The client flexes the untested leg so that the sole of the foot is flat on the floor about 6 to 12 inches. to the side of the body's midline. With the extended leg as straight as possible, the hands on top of each other, palms down, the client slowly bends forward at the hip joint, keeping the spine as straight as possible and the head in normal alignment, not tucked. With the spine, the client reaches down the extended leg, trying to touch the toes, and holds this position for 2 seconds. Place the ruler parallel to your client's lower leg and administer 2 practice trials followed by 2 test trials. Scoring part. The middle of the big toe medial aspect at the end of the shoe represents a 0 score. Reaches short of the toes are recorded as minus scores. Reaches beyond the toes are recorded as plus scores. Record the best score to the nearest half inch and compare it to the norms in Table 10.8.